Four. Yeah.
Yeah.
Right.
Yeah.
We're good. Right.
Well,
Okay.
Yeah. I'm just gonna leave on the other one.
Yeah.
Brilliant.
So if we go to page 7
on it.
of the manual,
Yeah.
yeah, we've got match 10 bony structures,
Yeah.
yeah, to a selection of descriptions.
Yeah.
Sorry, somebody's WhatsApp me exactly the same time.
Oh,
And
that's
I've
not.
clicked the
I
screen.
Oh.
All right.
10 bony structures to selection of descriptions and state their function.
Yeah. We're going to have name 4 bony structures corresponding to description and functions, and match 10 soft tissue to a selection of description, state, or function. Yeah. Name 4 tissue structures. Answer 2 questions specific. So if you look at those 4, those questions,
Yeah.
they're going to be showing you different structures. So if we take the neck, the shoulder, the elbow, the ankle, the wrist, the hip, the knee, the spinal column, it's really understanding the anatomy and the physiology around those structures, so that you've got an understanding of A, what that structure looks like, B, the anatomy and physiology associated to that, and then all the connective elements to it.
Can you repeat them structures again? You said neck,
Neck,
yeah,
shoulder, elbow, wrist, spinal column, hip, knee, and ankle. Yeah.
So that's 1, 2, 3, 4, 5, 6, 7. That's 8, right?
Yeah, that's 8. Yeah. And then all the other structures, they'll be all connected around it. So they'll all be similar type structures to those 8.
So there's actually a worksheet that we need to be filling this out on it when it comes to it further down the line, right?
Yes. Yeah.
Cool.
All right. Now for the practical massage assessment, yeah, there is no final massage. Yeah. If you've got your 7 clients that cover the 7 body areas, you need to pick 5 to write up for your case study. Okay. Of the 5 that you write for your case study, I will observe 1. Now, if you think you're confident enough to have a camera set up and to film it or record it whilst I'm watching you, I can write up in the workbook my tutor assessment observation sheet. Yeah. If you're not confident, then find a common meeting place if you've got a clinic space open, or if between you and the client you can arrange a home visit and you're happy for me to travel, I will come to where you are. Or you bring the client to Enfield Town on the weekends where I'm teaching. Yeah.
I'm just not confident about setting up a camera and then it going pear-shaped and then having
I understand that. I totally get that. Yeah.
I'm not a photographer, man, do you know?
Yeah. So once we do that, then that will count as my observation.
Yeah.
Because I've seen 1 of the 5. You've got 7, you're submitting 5, and I've seen 1. Yeah?
Yeah.
Now, is there anybody who's not clear about that? As to what that means? Yeah?
No, I'm clear.
We can arrange the dates as we go along. Yeah?
Rick, can I just go back a minute to the element 2 of the assessment.
Yeah, sure. We're going to
It-
talk about. I'm going to go to element 2 and talk about it in a bit more detail. But
Okay.
ask away.
Yeah, just like each bullet point
Yeah.
is match 10 bony structures to a selection of description and state their function. So is that one question?
That won't be one question, but that will be one segment with it will be
One.
one section, and then it will have 10 different, like A, B, C, D, E, F, G.
That makes
Yeah.
become clearer, right, as we further down.
Yeah.
Oh.
All right.
Go on, man.
So now you will have YMCA will send the task sheet, and we do it as a task activity. Yeah. You have the option and the choice to do it as a exam. We're gonna do it as a case study activity.
Yeah.
Right. So people will be able to complete the answers and share the knowledge together and complete it.
Cool.
Yeah.
So, example, if I research and find 10 bony structures, and then I put any findings on the WhatsApp group,
Yeah.
people can comment, feel free,
Yeah.
and then you could
Exactly.
correct, or you can put your bit in as well, right?
Yeah. And then collectively, as a group, students can fill in, use the same answers or use partial, and somebody else can research another element.
Yeah.
And then they can collectively complete the activities, and then that will be submitted as part of the coursework that gets submitted.
Because it feels repetitive, because underneath that it's the same question but just naming 4 bony structures.
Yeah.
So
Yeah.
it's the same question repeating itself, right?
Kind of. If I go to the next thing, certain things will become a bit more clearer.
Okay, I'll shut up. Go on.
No, it's all right. No. There's, asking questions is part of the learning process. So,
And how many people are
yeah.
on right now online here?
Yeah.
How many people are here online?
How many of you guys? There's 6 of you. 6.
Oh, Ross, no one's asking questions, man. Only me.
There's 6
Okay.
people. Yeah. So,
People.
yeah.
I'm not allowed to talk. I'm just listening.
Oh.
Yeah. So,
have we got to come in for any lessons? Or
sorry?
have we got to come in for any lessons? Or is
What
it...
I'm going to do is, I'm going to do, now that I've completed, in terms of like the level 3, I've got through anterior leg muscles, posterior and anterior leg. So I've been doing some drawing and sketching on students. I've done anterior leg, I've done posterior leg, I've done the back, I've done the upper body, I've done the arms, and I've done the glutes. Yeah. So now that I've done that, I'm trying to get the level 3 students to build up their hour maintenance session, work towards that. I'm going to be trying to deliver a lot of the theory and content online. And what I'm going to do is I'm going to start doing like an advanced shoulder. So I'm going to do a shoulder session. I want to do a knee session. I want to do a hip and pelvic session. I want to do an ankle session, elbow and wrist, and neck, cervical as well. So I want to do some detailed work on those segments in class.
Right.
Yeah.
Yeah.
So saying the or can observe if you choose to.
Yeah.
Cool.
So we're going to do observations. I want to go over some of the advanced anatomy and physiology. I want to go over some of the active, passive, assisted range of movements. I want to go over some of the special tests as well. So I want to do that for the joint areas.
Any idea of the when that's going to be? I don't want to press you now.
Yeah, I'll have some dates this weekend. I'll arrange dates for that.
Sweet.
I'll arrange dates for that for this weekend, so people will know what weekend I'm going to be covering what.
Yeah.
Yeah.
I'm going away soon
Okay.
for a week.
Nice.
For a week, yeah. For a
Yeah.
week.
Yeah, for a
Oh,
week.
okay. All right. Okay. Okay. That's not a problem. That's not a problem. Yeah. All right.
We'll be recording the sessions anyway and put it in the
Yes.
group.
Yeah. Yeah. We'll be recording the sessions. Okay. So if I go to not page 9,
Page 8.
let me come back to page 7. On page 8, we've got here palpation, observation, active range of motion, passive range of motion, resisted muscle testing, and one orthopedic test. So you should be at this stage into level 4. As part of your assessment, you should know how to palpate your client. You should know how to observe for imbalances, postural alignment, postural analysis. You should be able to do an active, passive range of motion and the resisted muscle testing. And you should be able to do at least one special orthopedic test for each of the areas, at least one. Yeah?
Can you
So
give me
my
an
aim-
example of an orthopedic test?
So an orthopedic test is an anterior draw test for the knee to test the cruciate ligament.
Mm.
That's an example.
Or a Thomas test.
Or a Thomas test. Yeah.
Cool.
All right. So you should be able to, my aim is really to get so that your assessment becomes a little bit more advanced from the level 3 assessment. Yeah?
Okay, yeah.
All right. Okay. And then we're also looking at soft tissue release, connective tissue, corrective frictions, trigger points, and muscle energy techniques. So these are advanced manual. So you've got Effleurage, Petrosage bimanual. Then you've got your trigger, you've got your friction in, compression, shaking, vibration, snaking, reinforced punching, you've got cupping, you've got tapotement, you've got ringing, and then you've got some advanced hand techniques that you can use as well. Yeah?
Yeah.
So again, so I talk a little bit more about trigger pointing. So some of the level 3s have done friction in, they've done compression. So trigger pointing is just one step up from normal compressions. Yeah? And we'll talk about that in a bit more detail. Yeah? So if I move on again, on page 13, we've got describe 2 types of joint end feel, stating a probable cause for each. So A and B is really just a descriptive term for what the end of the joint will feel like. So when you feel different types of joints, the feel of it, you're just describing it. It's not a medical term, it's not a clinical term. You just describe what it feels like. Yeah. Now,
like,
where
like
it says,
round or
not like round, but when you feel it, does it feel soft or does it feel hard?
yeah,
Does it feel grisly? Does it feel rough? Does it feel like there's like a hole?
yeah,
So you would describe that, and then at the bottom, when it says probable cause, you're gonna give a more clinical explanation as to why does the joint feel like that. Yeah.
yeah.
Does anybody not understand that?
Yeah, that's clear.
Everyone's quiet. Everyone's quiet.
Yeah, we have to talk to him and say it's clear, or otherwise he doesn't know whether to move on. So it's clear, dude.
Yeah. Are we
Yeah.
clear, Melanie?
Yeah. Sorry, I was writing. Yeah.
Okay, Marketa?
I'm fine with it.
Yeah, yeah. Everybody else is fine. Yeah? Okay. So we got there, describe what is meant by the following. We got intrinsic, extrinsic, primary, secondary, and non-consequential injury. So your intrinsic injury is something that is happening to you as a result of long-term or some body imbalances. Yeah?
Yeah.
Extrinsic is something that's happened externally. So if you're boxing and somebody punches you, or if you're playing football or rugby and you've been tackled and you've been tackled and somebody makes contact with you, then that's extrinsic. Yeah?
Yeah.
Yeah.
We know the difference between that. Or if you go jogging and you don't warm up properly and you go jogging every day, and as a result of that, you damage your hamstring, that's an intrinsic injury. Yes?
100%.
Yeah?
So
Okay.
self-inflicted and basically inflicted by someone else.
Yes, someone or something else.
Ah, someone. Yeah.
Yeah?
Yeah.
So your primary and secondary injury is the first injury. So if you damage your quadricep, that's the primary injury. Yeah?
Yeah.
And then the secondary injury is if you don't fix your damaged quadricep, if your hamstrings then become tight, or if you damage your hip and then your knee starts going funny, then the knee injury is not the primary injury, it's the secondary one.
Yeah.
Sorry. Yeah?
See?
Yeah.
Yeah.
Okay. What do we think the non-consequential injury is?
Long consequence.
Nothing's happened.
Injury.
Nothing appears to have happened. It's just painful.
Yes. Yes. Yeah.
Rick, you know these worksheets, it might be a basic question, but what I'm going to do, if it read, hello?
Yeah, I'm still here. Yeah.
What I'm going to do is just photocopy them,
Yeah.
research, put my work in, then come to the weekend, which we've got 4 of, and
Yeah.
then just bounce back,
Yeah, sure.
fill it in properly,
Yeah.
to give the proper sheet, yeah?
Yeah, you can
That's
do
a
that.
good idea.
Yeah, do that. So it says it outline 2 ways which inappropriate treatment or advice may influence the client's ability to recover.
Yeah,
Yeah.
good question. Yeah.
And we've got 2 reasons why it's important to conduct subjective assessment. And give 5 reasons when a client should be referred or deferred. 2 examples, sorry, not 5.
Yeah.
And 2 ways in which the aging process affects musculoskeletal.
Well, I know all about that.
Yeah?
Yeah.
So we're happy with like the 2 ways. Inappropriate treatment can influence. So if somebody has if somebody's been given the wrong advice, what do you guys think?
Like a deep tissue massage on an acute injury,
Yeah,
that would be an inappropriate treatment, right?
yeah. Uh-huh. And another one could be, just so that I'm not talking all the time.
Giving them wrong exercises to do, saying that you're
Yeah, giving them the wrong stretches. Yeah,
doing
wrong
good.
aftercare and wrong stretches. Yeah, yeah, that could. Yeah, that's one.
Mhm.
Yeah. And why is it important to conduct subjective assessment prior to treatment?
To see if there's anything that's wrong other than the thing that they mentioned.
Yeah, yeah. And
And
another reason.
how they subjective is about how they're feeling.
Well, the
Pain-
subjective assessment is your record. Because remember, you're writing down and logging what's wrong with the person as you assess them.
Oh, so
So
you've
what do
got
you think one of the advantage is of doing that?
so you can look back and monitor progress,
Right,
and
right.
that you're
Okay,
covered
yeah,
through insurances as well.
yeah, yeah, yeah. Because you've followed your professional due diligence.
Yeah.
Good.
Yeah. And 2 examples when a client should be referred or deferred.
When it's out of our scope of
Yeah,
what we can do,
yeah.
Well, like
If you
internal
feel,
skill
bleedings and
set.
stuff.
yeah, out of your skill set, if you feel that the person needs to see an osteopath or chiropractor or a chartered physiotherapist or a
Yeah.
surgeon or a doctor, where your scope of practice is slightly limited and you think that they should see somebody more experienced.
Difficult area, that one.
Yeah. Or if somebody's got a severe injury that's acute, they should go and see somebody else. So if somebody's broken their leg and they're on crutches, they shouldn't come straight to you for a massage.
Not on that area, anyway.
Yeah, yeah. So that's a good example of where you should defer them to the hospital or to the GP first before they come back to you.
Perfect.
Yeah.
Good stuff, man.
2 ways in which the aging process affects the musculoskeletal system. Anybody?
It starts to deteriorate. Like, you lose
Well-
muscle, don't you? After a certain age, you start to lose
We lose elastane,
Yeah,
definitely.
you lose
Yeah.
elasticity in the muscle, and what else do you lose?
strength.
Strength in the muscle. Yeah.
Yes.
So that's 2
That's
examples
it,
there.
yeah.
Come on, man. We got this.
Yeah, we got this. Yeah. And we've got some terms. Asymmetry.
Yes.
What's asymmetry?
I haven't got a clue what that
Is
means.
it
but
where it
asymmetric
looks
either
the
side.
same on both sides?
Yeah.
Yeah. So
Yeah.
your alignment, your balance and your alignment. If everybody in the whole entire world is wonky. Nobody's 100% aligned and straight. Nobody. I don't care who you are. I don't care if you're Denzel Washington. I don't care if you're
Oh, come on, Morgan Freeman is. He has to be.
Nah, he's not. I don't care if you're Denzel Washington. I don't care if you're Morgan Freeman. I don't care if you're Brad Pitt. I don't care if you're Angelina Jolie. Everybody's wonky. Yeah, but it's how wonky you are. Yeah,
I'm proper
Yeah.
wonky.
yeah. All right. Doesn't matter. Yeah. So asymmetry is that alignment with body balance between left and right, top and bottom, back and
Yeah.
front, or anterior, posterior, inferior, superior. Palpation is when you palpate on the soft tissue. Yeah.
Yeah.
Range of movement is how far you go through the range. And you've got, so if you do hamstring, can you bring your leg up to the 45-degree mark? Can you go any further?
What's the correct angle? What is meant to be like the norm?
There isn't. There's like normal range would be 45.
Okay, normal range is 45. Okay.
Yeah, for like general population. For advanced sports persons, some people can go way beyond. If somebody's a professional athlete and they can go to like
90.
70 degrees, 80 degrees angle, they can. It's possible.
Yoga and stuff as well, yeah.
Yeah, people that do yoga can get like 180, can get up to like 130.
And
You know?
people, what thing over hyper
Yeah, hypermobility.
Hyperextension.
When they can go
Hypermobility.
yeah.
yes.
Hypermobility, they can go beyond the normal range, like swimmers who can pull their arms, lock their fingers and pull their arms right the way around, back over their head
Yeah.
and all the way through. So you have people like that. Yeah.
So when
You
you
got
say
Go on.
passive and resisted,
Yeah.
can you say a bit more about that, please?
Yeah. So somebody's got pain in their arm and you tell them to lift their arm as high as they possibly can. Yeah.
That's active.
Yeah. Then they don't move their arm. They says, okay, I'm going to lift your arm as high as I can. And as you're lifting it, if they've got damage in the shoulder and in the tendons and the ligaments, their arm's going to be pulling. They're not going to want to go as far as you're going to want to lift their arm.
That's passive.
Yeah. And then resisting now is if you tell
Is
them
when they
to
push.
contract or tense their muscles and push against you,
Ah, okay.
if they're damaged, then they're only going to be able to contract a certain amount. Or if
Yeah.
you get somebody to stick both arms out and then you push against both arms at the same time, one arm's going to be weaker than the other, and the damaged arm, shoulder, will be weaker.
Yeah.
Yeah. You've got postural analysis, looking at your posture. Yeah. And then your functional tests and special tests are your orthopedic medical tests that you carry out. Yeah.
Yeah.
Like your Thomas test and your Uber's test and your sorry?
No, sorry, that was my mom.
Okay, all right.
Sorry.
That's all right. That's all right. Yeah.
Rick.
Yeah.
Mom
Rick,
was giving me a lecture as well. Sorry.
is
Yeah.
it true that you
Yeah.
can only Thomas test can only be performed on psoas